just gonna come out with it. I am a little bit nervous. I've even got my hair down, which if I have my hair down, you know I'm nervous about something. No, this is really nothing to be nervous about. It's more of I'm just excited and I wanna make sure that I'm gonna get it right. The first episode might be a little not so good, but anyway, it's your first episode and I'm sure that they'll get better as I go on. So, I am this is officially official, the first episode of the lifestyle podcast, vlog, whatever you want to call it. And I have my wonderful husband, business partner, baby daddy with me to kind of, just feed off questions and things like that. And just so I'm not talking to myself. So anyway, today, the first episode is about the elephant in the room, which is my big belly, okay? So yes, I am pregnant. This is my third pregnancy, if you guys did not know. I've had both of my babies at this house. One of them was in this living room and the other one was in our bedroom. And then this one, we'll see. So I have a lot of passion about pregnancy and taking care of yourself during pregnancy and delivery and nursing and postpartum, the whole thing. But before I get into that, I want to make sure that you guys know that this is my story and the way that I feel about things, and not take it the wrong way that maybe thinking that, if your story doesn't look like mine, then your story is wrong. So I just want to clear that out of the air and just let you know that everybody has their own story, and I'm just sharing with you my story and my passion about why I chose a home birth and all the other questions that go on with that. So do you have anything to say?
One thing that I think Ashley's always been, like she said, she's super passionate about the birthing and the pregnancy and the home birth and all that stuff. I think one thing it's important to point out is that you do have a choice in all this stuff. Like when it comes to your, what you want to do for your birth, be it in a hospital, be it at home, be it in a midwife center, you can lay out a plan for yourself. I think when we first started this journey with our first kid, we kind of just started it, and we didn't have a plan, but we went into the doctor for the first time, and I think we realized I don't really like the way this was going to go, because our doctor was kind of just telling us how it was going to be and not really giving us much control or say in something that I feel like is one of the most important things you're ever going to do. So as we got more into it, we realized there are a lot of different options out there. There's a lot of stuff you can look into. So if you've just found out you're pregnant and you're thinking you're along for the ride, or maybe if you had a kid and you were put along for the ride, I think it's important to recognize that there's a lot of options. There's a lot of choices out there, and it's important, I think, that you explore all of those and find, which one you're most comfortable with, which one makes the most sense for you. And on top of that, probably a little bit of a disclaimer. Nothing we're going to say here is technically medical advice. It's just
I meant to say that too.
our own personal experiences. So, we're working on our third one. We've had some experiences. We've made some mistakes. We've done things we liked and didn't like and whatever. So this is just what has and hasn't worked for us. And answering any of these questions, it's not medical advice. Before you do anything, obviously you need to talk to your doctor or your midwife about any of that stuff. But most of this stuff I think is just personal preference and tips and tricks, stuff like that. Nothing seriously medical, but seriously, talk to your doctor.
I'm so glad you said that, 'cause I had that in my head to say that and then I forgot to say it. But yeah, that's huge, is knowing that you have a choice, because I don't think that
I know we didn't know.
You just don't think that you have a choice. You don't even think about.
I didn't even know what a midwife was before.
Yeah. So you do have a choice. This is your journey. This is, you're the one who is going to have to deliver this baby. So it's definitely your choice. It's not anyone else's choice on how that goes down. Of course, there are, we can get into that later. So So let's go over the first question.
So I think you posted on Instagram, like, does anybody have any questions about birthing? And this is the,
Yes.
where are these questions coming from?
Instagram.
Okay.
Yeah. The first one was, I think it was, and I've only read them like a couple times. I haven't really thought about what I'm going to say. But the first two were correlated, like why I chose this.
Okay. Can I like try to say their names?
No, don't say their names.
Don't say names. Okay.
No.
Do you have somebody help you after the baby? Question. And how do you feel? Question.
So this is huge. If you do choose to go with a midwife, postpartum care is something that I do feel like using a midwife is slacking a little bit. You have to, once you have the baby, right? If you have it in your house or in a birthing center, you're required to do certain things. Like you've got to pee, you've got to make sure that you've had a meal, and a couple other things like your fundus is going down and stuff like that. So there are some protocols that you do have to make sure that you're doing before the midwife leaves, whether it be a birthing center or at home. And just know that a birthing center and home is the same thing. They provide the same equipment as they would at a birthing center as they do at your home. So it's just your preference and what you feel most comfortable with. For me, once I knew that they provided the same equipment, nothing beats the comfort of being at your own home. Like when you're uncomfortable, if you're not feeling well, if you're sad or whatever, like you want to be at home, right? So that was my biggest thing from the get-go, and is I was torn between birthing center and home. But then once they told me that, I was like, okay, well, I'm gonna do this at home. But so there are certain protocols that you have to do before the midwife leaves or you go home. And but then once they go home, it's like, here you are with this baby, and you don't know what to do. You know what I mean? I mean, you do know what to do, and I mean, for Adam,
No, you don't. You don't know what to do.
Well, they go over what the partner should do.
The second time you do.
They go over what the partner should do. So like making sure that, checking the baby's heart rate every so often, checking my heart rate.
They give you a little spreadsheet.
Giving me,
every 2 hours, I think.
Yeah, making sure that every 4 hours that I take ibuprofen, and making sure that my fundus is going down. So they go over all that. But like for Matt and I, my first pregnancy was over 22 hours long. We were both exhausted, and there was no way in hell that was going to be able. We were going to be able to, like, he was going to be able to take care of me. I mean, he probably would have, but I mean, he was out, I was out. So the biggest thing that I recommend if you were to use a midwife is to make sure that you have someone come over and stay with you for at least, I don't know, maybe three to 5 days. To make sure that you're being taken care of. You're taking your ibuprofen every 4 hours, checking the baby's heart rate, my heart rate, and making sure that my fundus is going down. So
the whole obviously when you're doing this at home, like the whole birthing experience, well, regardless of where you do it or how you do it, it's intense. And then it's like, but the midwife's there helping you, guiding you every step of the way, telling you what's gonna happen, telling you how things should be going, telling you everything's fine and it's all good. But then like after the baby's born, she looks at me and gave me a couple tasks and gave me a clipboard with a spreadsheet on it and a pencil and said, give her ibuprofen and check her temperature and the baby's. Peace. And I'm like, what?
Yeah, no. And
so it's just like kind of like overwhelming to go from a house of 2 to that 22 hours of insanity to now a house of 3 and an infant that I've never taken care of a baby that small before.
And you're exhausted.
And you're beat up, tired, and it's just like, what do I do now? Like, it's overwhelming. So, yeah, definitely having somebody lined up. Yeah. A mom.
And we're fortunate enough that his mom is a nurse, and so she packed a bag and just came over and took care of us. So I strongly recommend that you set someone up to come over to your house for at least 3 to 5 days to make sure that you and the baby are being taken care of. So, you know, the parents can rest and take care of the baby too. So yeah, that is my biggest advice for if you were to use a midwife.
It makes it made the experience a lot more enjoyable, I think, just
Yes.
because I could kind of relax and just enjoy being around the baby and do all the things, you know, a lot of skin to skin, a lot of time just holding the baby and taking care of the baby versus and have someone there to kind of oversee and make sure everything's okay versus if I had been by myself doing all that, I think I would have probably been scared out of my mind. And
I would have been scared too. Not that I don't trust you, but I mean, you know, like you've got to know what you're looking for when you're feeling the fundus and stuff like that. And like I said, they go over that, but you're just so exhausted and excited about the baby, like you're not really paying attention. So have someone there to make sure that they're paying attention and they know what to do so they can take care of you. And so it'll make it more enjoyable for you and a lot, you know, less stressful after postpartum care. Did that answer the question?
yeah, no, I think just aftercare and how you feel. How do you feel about? Maybe they were talking about how you feel about having someone there afterwards.
Oh yeah, definitely have someone there afterwards.
Yeah,
for sure.
Yeah.
For sure. Have
Before
your
the
mom.
midwife leaves, have somebody come in.
Yep, that's a must.
All right. And honestly, by that point, like after the baby's out and born and everything, like, you know, if it was even just a friend maybe who had some medical experience or something like that, like it doesn't, there's not anything, you know, like exposing yourself anymore or anything like that. It's just a baby and I don't know. It doesn't have to be a mom is what I'm saying. All right. Did you have any type of pain medication in labor? Thanks for joining us, guys.
So, hang on. So when you use a midwife and you are at a birthing center or at your house, there is no pain medication at all. It's completely natural, and that is, you know, one of the reasons why I chose to use a midwife, because that option of using medication was completely out of the question. For me, like it wasn't available to me. So I felt like if it wasn't available to me, then I couldn't use it. I mean, you know, I had no escape. So no, there is no medication or anything like that when you're using a midwife at home or a birthing center. You can certainly use a midwife in a hospital, and you can have that option to use medication if you're at a hospital. But if you're at a birthing center or your house, there's nothing provided for you. You go all natural.
Guess that's pretty straightforward.
Yeah.
Lots of ibuprofen afterwards, though.
Yes, lots of ibuprofen afterwards.
All right, next question. Oh, I lost my place. Will you talk about your first time doing a home birth and how you came to that decision, why you decided to do a home delivery?
All right, so I have two answers to this question. My first answer was with our first child, and I would say that my main reasoning was more selfish reasonings than like the answer to my second question. So at the time when we found out that I was pregnant with our first child, I was a competitive athlete, and I knew that, you know, when I calculated when I was going to deliver this baby, I calculated my recovery time to when I needed to do the open, perform at the open, and then when I needed to perform at regionals, which gave me about four months recovery time post baby. So I was seeing an OBGYN originally, and this OBGYN actually, his father delivered me, so I I've been seeing them for a really long time and was very comfortable with them. So, you know, I told them I was pregnant. I had my first appointment and we got to see the baby for the first time. Everything was all good and dandy. And then I was actually seeing this OBGYN for my entire first trimester. And when we sat down after the first couple visits, we just went over like my birth plan, if you will. And I told him that I was very specific on what I wanted. Like, I absolutely did not want a C-section because I wanted to recover as quickly as possible. As long as baby and I are healthy, I did not want a C-section. I did not want an unnecessary C-section. Anyway, and he just kept saying, well, we'll see when that happens. And, you know, I just didn't feel like he was listening to me, and my response was, no, we won't see what will happen. Like that is what will happen as long as the baby and I are healthy. Like, I will not get a C-section. And so anyway, so we left the appointment and I like started crying, and I just knew that there had to be another option out there for us. And so I was super upset for at least a week, and then it was like a godsend. One of my friends messaged me randomly, haven't spoken to her in a long time, and just said, hey, you know, I saw that you were pregnant. How, you know, you should really look into using a midwife and doing a home birth. And I was like, what? She's like, yeah, you know, you should watch this documentary called The Business of Being Born. I think it's really something that you would take interest in. And so it got me thinking, and we watched The Business of Being Born, and I was like, oh hell no! I've got to do my research and try and find a midwife. So we found one, and the first one we didn't connect with very well, just because they were very against exercise and, you know, lifting weights, which is what we do. So I just knew right then and there, like, we weren't gonna connect. And so we ended up finding another place. So this was our second place. And again, now, mind you, like, I was super discouraged now, because here I am in my second trimester, and technically I don't have any prenatal care if I were to continue to stop going to the OBGYN. So anyway, I found this other place. We loved it, connected with them very well. And so that was my first reasoning, was more selfish. I wanted to make sure I was recovered properly. And I honestly didn't even want, you know, at the time I had really bad back pain. So an epidural was something that was out of the cards for me as well. So I just didn't even want that option. I didn't want to know that, you know, because I knew it was going to be intense. I knew laboring and delivering was going to be intense. So I didn't even want the epidural option to be right around the corner. So I didn't even want to be in a hospital. So that was another reason why I used a midwife. So it was more like my first response was, and the reason why I chose it was probably more selfish reasons than anything, because I wanted to recover faster and I didn't even want the epidural to be an option for me. So then after I had experienced what I experienced with my first, yes, it was super intense. My labor was 22 hours long. It was the hardest thing that, it was the hardest work that I've ever had to put in my entire life. And for Matt as well. Like, when I was in labor, Matt lost, what did you, like 10 pounds?
Yeah, I was like over 10 pounds in 22 hours. Or 20, yeah.
He was 200, and then you weighed yourself and you were like 190.
Yeah.
So it just, you know, but like, I wanted to relive that again. It's just, it's indescribable. So then my, you know, when we got pregnant with my second baby.
His name's Leaf.
With Leaf, we got pregnant with Leaf, But actually before then I became a doula because I was just so in love with the whole process of laboring and delivery, and I wanted to shout it from the rooftops that every mom should know that they have a choice to experience something like this, even though it is intense, yes, and I know that, you know, that's my decision that I just wanted to experience that intenseness, and call me weird, whatever. Anyway, and so I became a doula, which is like a laboring coach, a labor and delivery coach. And anyway, so then I really started to learn, and I did a lot of hospital births, and I just started to see, you know, really what was going on in the hospitals. I feel like it's totally changing now, and we're changing more towards, you know, letting the mom progress naturally. And I could talk about this forever. However, you know, I only know that I have, like, I want to keep your attention with me. So, so now when I got pregnant with Leaf, like, it was more so like, no, I'm doing this because it's the best thing for me and the baby. It's the healthiest thing for me and the baby. And, you know, having an epidural and things like that can totally slow down your laboring process, which will lead to just having medical interventions can lead to unnecessary things. So
I think one thing it's important to point out is that, like, trying to do a birth unmedicated and avoiding surgery, a C-section, unless it's absolutely necessary, requires a really strong, focused mindset. And if you go to a hospital, you're surrounded by people who have, most of them have pretty much just the opposite mindset.
yes,
So they're
like, they don't want to see you in pain.
Right, and they're the ones that are controlling your every move and they're around you all the time. So that influence is going to be really strong over you versus being around a midwife at your home where it's just their influence and you guys are on the same page. You've gone over your plan. You know what the plan is. You know, you're basically in a hospital, you're putting yourself in an environment where you're surrounded by people who are not really on the same page as you.
Right.
At least back then in your situation.
Yeah. Yeah. Like I said, I really feel like hospitals are getting better about, you know, being comfortable with seeing the mom uncomfortable, but, you know, it's their job to, you know, push medication on you and things like that. So when we got pregnant with Leaf, like, I was doing it because of my second reason is because I was doing it because of the baby. Like, I wanted to do whatever was best for the baby, and not necessarily for me. So it totally switched. So, you know, like I said, there are a lot of unnecessary medical interventions when you choose to go to a hospital. And if you do choose to go to a hospital, like, if that's what you want to do, just be educated, and just be educated. Like, know that you have the right to say yes and no to things, and just know, like, just be aware of what's going on and be dead set on what you want. But then also be okay if things veer in another direction. You know, and that's anyway, that's my biggest reason. Those are my two answers for choosing a home birth, is because I feel like that is honestly, like, our bodies are designed to do this, and so why not, you know, do it at home with the least amount of medical intervention as possible.
Very good. All right. What's your favorite part about having a midwife?
My favorite part about having a midwife would have to be that they literally listen to you. They sit down with you every visit and you just talk. My midwife is one of my really good friends. I have her personal phone number. I can call her whenever I want. I'm not just a patient, if you will. So it's a totally different experience from seeing a doctor and then having a midwife. They're just two different. One's a doctor and one's like basically a person.
I think another thing about a midwife, kind of like you said, I always felt like Rebecca is on our side. We're like a team, the three of us.
Yes.
And like, you know, the birth is, well, it's not battle, but it's like going into battle, and it's like, feels like they're on your team. Versus after the conversations we have with the doctor, I was like prepared to go to battle with the doctor. And I'm sure they're not all like that, but that was like coming out of some of our appointments, I was like, okay, I'm gonna have to fight this guy on this. Whereas when we went with Rebecca, or with our midwife, it was almost like we were, you know, we had another team member, another person to kind of...
Who's on our team.
Who's on our side, right.
Yeah,
so.
and you know, midwives are going to do everything that they possibly can to make sure that your birth plan goes into place and there's no unnecessary things that can happen. Like if you end up getting a C-section, it's going to be for a reason, not an unnecessary reason.
The right reasons, yeah.
Yeah.
Okay, next question. Tips for dealing with contractions, obviously unmedicated.
So yeah, dealing with contractions, you start to, when you get contractions, you will feel them coming on. And it's important, like my biggest tip for you, I have lots of little tips and tricks, but my biggest tip for you is when you feel it start to come on, you have to, and this is gonna be a little bit weird, but you have to start breathing to catch up to it, because it's gonna peak, it's gonna start low, and you're gonna feel that, and then you need to start breathing immediately, like you're doing like a really hard workout and you're trying to catch your breath, because you wanna get that oxytocin into your uterus as much as possible. And so once you start to feel that contraction coming on, you need to start your breathing right away and keep breathing, because your contraction's gonna peak and then it's gonna come back down. And if you can catch your contraction right when you start to feel it and start breathing through it, it changes it 100%. Like it can take it from 100% pain to maybe 70% pain. So catch it early with your breaths. Keep breathing, and then cycle down once it goes down, and then breathe back to normal, and then you'll feel it coming on again, and then you'll start breathing again. So catch it before it's too late, because if you start breathing at your peak, you just got to get through it at 100% pain level. So, but if you catch it soon enough, you can take that pain from 100% to probably 70%. And also like headphones, like music, listening to music, and just being completely zoned out from everything else that's going on helps tremendously to get through your contractions.
When do you feel like you discovered that? Was that with Adam?
No, I did not discover that with Adam. No. I discovered that with this guy. Well, just from being a doula and stuff like that. I had seen over 10 births. I had, doulaed over 10 births. So I saw that through those births, and I implement it with Leaf in it, and I'm like, oh, okay, that's how I'm supposed to do it.
Was that a tip that you would give the moms that you were working with to kind of help them?
Yeah, yep.
Cool.
Yep, and just let them be aware of that, and so, yeah.
Cool. I had another question. Oh yeah, another question. Kind of like, I guess maybe this is something to just to kind of go along with that. Like, I guess I always envisioned a contraction as something like you go against or you've got to get through, but it's part of a process. So it's like you're not fighting the contraction like I would know, but just kind of from hearing her talk about them, like it's something you want to go with, and you got to get through it, but you want to go through it, and it's kind of part of the process. So you're not fighting it necessarily, you're just kind of like letting it happen, but trying to let it happen in the most productive / if you can breathe a little bit and get rid of some of the pain.
She can open it for you.
That makes sense to me. But in my head, it used to be something that you were fighting against, like you were trying to resist.
Yes.
But after hearing you talk about it and hearing you describe it and watching you go through it, it's clearly something you're kind of going through and working with. It's part of the process, not something to be resisted, but something to be kind of worked with. Like you work with it.
Yeah, and yes, because with Aden, I fought every single contraction, and that's why it lasted so long. And I also did not trust my body, and knowing that this is what it was.
Mommy and Daddy's room.
She's in Mommy and Daddy's room. It was not something that I trusted going through. So like with Leaf, I knew that like, you know, I had a lot more trust in myself that I could get through it. And knowing that like our bodies were literally designed to do this. So that helped me get through it as well.
Cool.
Don't fight it. Just go with it, because it's gonna happen. Fighting it will just prolong it.
What happens if you tear? Do you get stitches?
So if you were to tear, then, which I did tear a little bit with Aden and a little bit with Leaf, but not enough to get stitches. So after you have the baby and then you deliver the placenta, which you got to deliver to the placenta, that's always a shocker. So you have two births. They examine you, and if I were to have torn to a degree that I needed stitches, then that's when she does provide Novocaine. So they examine me and make sure, you know, that I don't have any tears that needed stitching. But if I were to, so I tore just a little bit, but not enough to need stitches. But if I were to have torn bad enough to have needed stitches, then they would have provided me with Novocaine. So the one thing that my midwife said, like after I had Aden, and she's like, okay, I gotta check you to make sure, you know, there's no tearing. She's like, but don't worry, you know, we're gonna numb you up. You did the work, we're gonna numb you up for this. So they totally numb you up if you need stitching, if you did tear. However, though, you know, tearing usually does not happen when you have natural deliveries. It does happen, but it's rare. Just because when you have a natural delivery, you literally feel everything. So you are a lot more cautious when you push. However, if you were to have a very fast delivery, then that's usually a lot of times when tearing will happen. If it's a super fast delivery and you like just have no control over anything, that baby's coming out, and there's not a lot of calmingness. So that is when
don't give the tissues a chance to stretch.
Yeah. So like, you know, with Aden, I pushed with Aden for almost 2 hours. It was absolutely exhausting pushing, but I was relieved to feel that feeling of pushing and not those feelings of those intense contractions. But however, you know, it took me 2 hours, almost 2 hours to get Aden out. So it was a very slow process. So maybe I believe that's why I didn't tear. And then with Leaf, he came out a little faster, so I did tear a little bit more with him, but again, not bad enough to need stitches. So Leaf only took about like 20 minutes to get out.
He's fast.
You know, so anyway, so yeah.
Bottom line probably is, it feels like they were probably wondering, like, if you tore it, would you have to go to the hospital to get stitches? No, your midwife will do that for you right there in the house. So
yep. And that's, I think that you know, that might be, I would love to have my midwife here to answer that question for you, because I don't know. I mean, I do know that some tears are so bad that might require more medical attention. I don't know. I wouldn't know.
Please defer to your medical professional.
Yes. Or ask your midwife if you choose to go with a midwife if you do tear that bad. But most of the time when you're doing a natural delivery, you don't ever tear that bad.
I think that's all the questions.
Okay, I think there was one about postpartum care.
Oh, there was. Yes, that's
and
it. It just says postpartum
without making
care.
this, without making this too long, I think that that's a great question, but it's a pretty vague question. Like, I mean, I could go
We'd
into
probably do another episode on that.
yeah, postpartum care. Listen, I'm not going to cherrycoat this to you. When you have a vaginal delivery, your vagina is extremely tender. And it's like 10 times the size that it normally is after you have the baby. So
Perfect.
the biggest like relief that I can tell you, two things, is get maxi pads and fill them with witch hazel and put them back in the freezer. They call those padsicles. Those are so much relief. That coldness with the witch hazel is so much relief on your hoo-ha after delivery. So I did that anytime I was awake. And then also a blow dryer. Blow dryers feel awesome on the hoo-ha after delivery. So that, I mean, again, I think postpartum care, that's a pretty vague question, but I mean, that's one of the concerns that was one of the concerns for me was how is
Sounds
my
like you're talking about acute recovery. I feel like postpartum care is more like a weeks after, month or so after question, but I don't know. Be more specific with your question.
If I wasn't that specific with that,
You know what? You could probably ask on Instagram. Give me your questions about postpartum care.
yeah, nobody asked me if I pooped. I can't believe that. Anyway, so
I've never seen you poop, so.
So I hope that, just to kind of wrap this up, I hope that answered some of you guys' questions about using a midwife and labor and delivery care, tips and things like that. I would love to do another podcast on this, but please know that this podcast, episode 1 is and then episode 2 doesn't mean that episode 2 is going to be about pregnancy. Okay, like the lifestyle way, I feel like is a very broad topic to go over anything. Like I'm going to be as real with you as anything about anything. So we can talk about fitness, nutrition, pregnancy, whatever it is. So I'm super excited that I've officially launched my first episode of the Lifestyle Vlog podcast. And, I do have one question though. Like, I have a question for Matt. How do you feel like I am doing with this pregnancy, or like I do? How do you feel like I do with pregnancies? This isn't a trick question.
Physically, emotionally?
All of it.
Okay, so physically.
And be honest, because I mean, I'm not going to get mad at you after this. But.
I do feel like Aden's pregnancy was our best one, both physically and emotionally. I feel like, I don't know if it's because we didn't know what we were getting into, or physically your body hadn't been through it before, so you weren't as, abused, I guess, by the whole process. But physically, I feel like Aden's, at least leading up to the actual birth, maybe not the actual birth. The actual birth was longer and harder, but leading up to the birth, I think you felt more normal. You were able to move better. I think both with Leaf and this one, the baby to be named later, physically you've been a lot more unable to do as much as you were with Aden. So
yeah,
physically.
and that might be because we've got 2 kids now and businesses and things like that.
Yeah.
So it definitely is more taxing on the body, and he's being really nice. Like,
well, I'm just, I haven't got to the emotional side
I can get kind
yet.
of mean. Okay.
I was just kind of breaking it down because physically I feel like, that's what I identify physically. And I was under the impression that this one was worse than Leaf. You told me the other day that you feel like this one's not as bad as Leaf, which I kind of saw them as being pretty even, if not maybe this one a little worse. But you told me that you feel like this one is better physically than Leaf.
I think I'm just more so tired with this one.
But you don't have as much pain, movement, and stretching and round ligament pain that you had with. I do remember with Leaf, you had like round ligament pain like crazy.
Yeah.
I guess you've only had a little bit of that.
Yeah.
Yeah. Emotionally, the first pregnancy is kind of like a honeymoon. I feel like it's like all, you know,
you're just excited.
unicorn farts and rainbows and all that stuff. The second one, when you already have a kid, you know, I mean, basically it's like anything. Once you have that first kid, everything gets a little bit harder. So the second pregnancy, because you already have a kid in the house, is going to be a little bit harder. It definitely doesn't have the same amount of like it's not a big a deal because it's not your first one anymore. So it doesn't have that, you know, uniqueness to it, I guess you could say. And I guess with like I don't know, probably most people's relationships is like this. Like when you have the first kid, all you have is the first kid and a dog. And like with us, we had one kid, a dog, and one business. Mm-hmm. And then by the second one, we had a dog, a much bigger business. Well, yeah, much bigger business, and we were in the process of acquiring another business. And by the end of the second one, we had two or three businesses.
Yeah. And
then for this one, we have 3 or 4 businesses now at this point. So like, it's not just the kids that's become more, it's just everything has become more, I feel like. So it makes the pregnancy, well, there's just much more stress in general, and you're less able to buffer your stress with exercise like you normally would, with working out like you normally would, with eating right like you normally would, so you're not able to cope with all that stuff like you normally would be able to.
Yeah, and like I want to tell you guys, you know, if you are pregnant right now, that you are not alone in this, because I know that it is super scary right now with this, you know, virus and things like that, and there's a lot of unanswered questions. I don't know. Would you call it questions? I don't know. There's just a lot of uneasy. There's a lot of unknown, and pregnancy is a huge part of like the unknown. Like, I don't know what's gonna happen. Like this baby I could have a C-section. Like I don't know. You know what I mean? So I just want to let you know that if you are pregnant right now, and you're about to have a baby, like you're right there at that tail end and you are feeling super scared, that you're not alone. Or if you just found out that you're pregnant, you know, I just want you to know that you can reach out to me anytime to just talk or whatever, because, you know, I feel like I'm going through that with you, and I'm scared, but I'm really, really working on, you know, just trying to, I mean, because this baby's going to come out regardless. So I'm really trying to focus on what I can control, which is trusting my body and doing my meditation practices to get me ready for delivery. So, you know, if you want to reach out to me, please reach out to me, and just know that you're not alone during this time.
Yes, and we decided on a name for the baby.
What?
If it's a boy, it's going to be COVID. And if it's a girl, it's going to be Wuhan. Just makes sense. And regardless of whether we name it that or not, that'll probably be its nickname. I'm just saying.
Yeah, it probably will be. Oh, man. So, anyway, you guys, thank you so much for watching. If you have anything that you would like for me to talk about in the next episodes, please message me.
Yes.
And I would love...
That is the hardest part, is coming up with topics. So please bring on the ideas, even if you think it's obscure and weird and off the wall.
It's never obscure or weird.
And we could...
Ever.
It doesn't always have to be really long either. We're happy to do just a few short minutes and hit a quick couple bullet points and move on. So yeah, please bring on the ideas. Yeah. That's a huge help.
Yep. All right, guys, thanks for watching. If you enjoyed what you saw, please share it and subscribe. Do the whole shebang. I would much appreciate it.
Thanks, guys.